They're just a wonderful organization that does superb work.
If it wasn't for this clinic, I probably wouldn't even be here now because I was diagnosed with cancer that I didn't even know I had. It was very severe at the time it was diagnosed, and I didn't even realize that I was as sick as I was, and because of the people here and the referrals they've given me, it's probably corrected and saved my life.
I really love this place. I mean, they get to me. The people who works in here is really nice, and that they have really helped me out 150%.
This is another road to being able to help yourself mentally, physically.
You are on the verge of needing surgery, okay? I'm just saying it the way it is. I think this clinic should be supported by everybody in the community because it helps this community. And I think that anybody here who has the opportunity or the ability to support it should. I think it's a wonderful thing to keep people in this area healthy, to save the hospital expenses, and to be able to give better care to the people in the community. I just think this is a very worthwhile organization, as well as being a very enjoyable place to work.
98 cents out of every dollar you give goes directly to patient care. Unlike other places where you have high overhead due to salaries and costs and all that type of stuff, the reason we can provide that kind of service here is because the volunteer component. Your physicians are volunteers. A lot of the staff out in the front office area volunteers. And that is why we can provide such good quality care at such a low cost.
I remember when, as a boy, I had a toothache. And my father and mother had to scrape to get me $3 to get my tooth extracted because it was abscessed. And this has stayed with me all my life. And the patients are very, very happy because they come here, there's no rush. They're treated with respect and given all types of assistance, which may not even be medical assistance.
Everybody went shopping and bought for one of the children. And this in here is cash, $300 cash for you. But I thought you might need the cash for something. Okay, this is from the neighbors, not just from me. All right, Merry Christmas. You're welcome.
There's a lot of people in the community that who fall through the cracks. They need some assistance, and it's a good feeling. The patients are very appreciative, and the staff is fantastic, and it's very nice. I enjoy it.
You're exercising, keep everything flat. But what this does is, this, especially when you step on that piece of tape, it limits the motion up. The more you come up, the more this bone jams on that bone, and it creates that swelling or that bone to bone. Okay.
It's been unique in that all of the medical resources in this community, as well as the community itself, have combined to make this clinic work. In this economy, with more and more people losing their jobs, more and more people are doing without health insurance, so we are having an increased number of patients coming to us who need help.
They come to this clinic with usually a few medical problems that are chronic that have been untreated. And either we're diagnosing it here and initiating treatment for them, or they've been aware of it and tried to take care of it themselves or ignored it, or they couldn't afford the treatment. So,
well, I really think that our patients tell it all, tell the whole story. They're so pleased with us and so happy with the care they're getting, and they couldn't get this care anywhere else.
They got my blood pressure down, they got me off of smoking, and taking care of other problems that I've had. It's a great place to come. If you don't have the money or the means, they need to contact VIM.
I think the need is increasing. Hopefully the clinic will be able to meet 90% of the needs. I think the main problem that we have is getting the word out that we're here and available for people that need it. The people that don't have health care in our community go to the emergency room. Their needs are not always met there, and then they don't have anyone to be referred to follow up care for them. It's critical that these people do get medical care, and it keeps them out of the emergency room, keeps them working, and helps them to stay well.
We go by 200% of the poverty level, so we have to make sure what their income is and any resources they have. Now the trend seems to be a lot more male because they're losing their jobs, and a younger group coming through, couples that we didn't have a lot before. Requests, to be screened have increased dramatically in this past year.
We all know the affordability and the accessibility of care is becoming more and more problem. Little things we do to give back and be accessible really goes a long ways.
Being a healthcare provider, I personally don't think that there's anything more important than we can get than access to good health care. So it's just a natural for me to keep my hands in medicine since I'm semi-retired, but still be able to take care of patients, and patients who truly have a need. It's nice to come into a setting where you don't have to be productive and see X amount of patients per hour and make sure all your billing and your charges are okay. We can do really good medicine here, great follow-up, because we don't have those similar constraints. I just wish there were more of us who were here.
It's totally changed my life. I didn't have health care for a long time, like 10, 12 years. I was scared at first. I was like, I don't know. And I finally came here, and it's unbelievable, everything that's done for you.
When the patients first come in, especially if they're a new patient, they're apprehensive. They're not quite sure what they're going to find here, how people will react to them. Will they be helped? So many of them have serious illnesses and serious concerns. I find that we are really able to help all of them.
And we're happy taking care of them. I think it makes us better people.
This is the most important thing I've ever done in my life, following a very successful private practice in Stamford, Connecticut.
I started going to the clinic because my parents started going here. As soon as I turned 18, they got me in to get me qualified because we don't have health insurance. And it's really helped us a lot. Any stereotypes that people might feel about a free clinic, you don't have to feel that here. This is this is a community, and here it's a family.
I love it. I wish we had more places like this. I really do. I love it here.
It's a godsend to those of us that have no other option.
You always felt like a second-rate citizen, but they make everybody here feel great.
I just think the care given here as compared to a free clinic is just superior in almost every way.
They're giving their skills to you for nothing in return. And I don't know how to say thank you enough for everything they've done for me. They're amazing here.
Everybody who works over there is an unsung hero trying to do the right thing for humanity.
The United States has the greatest medical care in the world. We certainly do. Bypass surgery, stents, all sorts of incredible imaging studies to diagnose disease. But if you can't afford it, you're not getting any. And people are dying in this country. People who had good jobs, people who are not freeloading on the economy, were literally dying of diseases that are eminently treatable because they can't even access a doctor. They can't even access primary care. That causes me great chagrin. And if I can do something about that in one county in this country, then I've done something with my life.
I used to think maybe I should be ashamed to come to a free thing like this, but it's unbelievable. And without them, I don't know where I'd be right now.